The following Ardelyx podcast is intended for informational and educational purposes only and cannot be considered as medical advice. Please speak to a healthcare professional before making any treatment decisions.
Hi, everyone. Welcome to another episode of the Gut Matters podcast. It's our first one for 2026. We're back for season 2. So welcome back and thank you all so much for all of your engagement, all of the listeners who have supported the podcast in 2025. We actually have almost 300,000 of you who have listened to the podcast in 2025, and we're just so honored and so grateful for your support. So welcome back, Andrea. Nice to see you again.
Hi, I'm glad to hear you be here and see everyone, and Happy New Year to the whole team.
Yes. So, Andrea, today we are excited to share another patient story. We both really love it when we can bring patients on to the show and have them share their lived experience with IBS with constipation. So today we are excited to welcome Katherine to the show. Katherine is a patient. She's done a number of patient storytelling and patient education projects with us over the years at Ardelyx, and we're so pleased that we finally got her on the podcast today.
Thanks for having me. I'm really excited about being here.
At Ardelyx, we're dedicated to improving the lives of patients by discovering, developing, and commercializing first-in-class medicines that advance care to patients with unmet medical needs. Learn more about us at ardelyx.com.
Well, Katherine, I'd love for you to maybe share a little bit about yourself so that we can maybe get to know you a little bit, who you are as a person, where you live, what you like to do in your spare time.
Well, I live in Miami, Florida. I'm a psychotherapist and in my own private practice. I work with all different types of conditions. I do a lot of work with trauma, but also chronic illness. And what I like to do for fun? Well, I love traveling. And we're actually, my partner and I are going to Vietnam in a week and a half. We're really excited about it. So actually Vietnam and Laos. And we love going on little adventures and trying new things and, seeing everything that the world has to offer.
That's great. I love to hear that you love to travel because I'm sure that there's been a lot in terms of your own personal journey and health over the years as well that, can sometimes impact things like that you love to do on a daily basis. So very cool that you've got a huge trip coming up, and I can only imagine how life-changing that can be.
Yeah. Well, actually, my health journey started as a result of travel. My parents, my mom was a travel agent growing up, and we would go on a family vacation every summer. And in 2005, we went on a vacation to Morocco, and we were drinking bottled water. I was being very careful with what we were eating, but somebody prepared our food who was sick, and I ended up getting typhoid fever. So when I came home, I ended up in the hospital for, I think it was 3.5 weeks. They didn't know what it was at first, and they were testing me for everything under the sun, and I was just so profoundly sick. And they finally figured out it was typhoid, and I started to get better, but my bowels never got better, and it just kind of got worse. So I first went the infectious disease route because I thought, oh, maybe it's from an infection from, Morocco. And they said, no, you're fine now on the infectious disease route. And so they kept on bouncing me around to different doctors and different specialists. I call them ologists, zoologists. And then they found out through rheumatology that I had what's called the positive ANA, which is one of the markers for autoimmune disease. but I didn't fit into a perfect little box. Some of my blood work was negative. Some of my blood work was positive. Meanwhile, I was getting worse and worse. And it wasn't just my bowel, then my joints started to hurt and I was getting rashes and all kinds of weird stuff. Eventually, they diagnosed me with post-infectious IBS. And so there was some clarity there, but I still felt terrible. Fast forward, I got I have 3 different autoimmune diseases and complications as a result of those autoimmune diseases, which impacted my overall health and well-being.
Yeah.
But it took a really long time to get there. And it was years of really suffering and being dismissed and having my symptoms minimized. Oh, it's not that big a deal kind of a thing, but it really was a big deal. And I went through a lot, unfortunately, before I finally got diagnosed.
Yeah, gosh. I mean, it's interesting that let me say that many patients have a number of other diagnoses, some autoimmune, some more like pain syndrome type fibromyalgia, chronic migraine, things like that. And I think, in our minds, we think, well, that wouldn't influence our guts and our constipation or abdominal pain. But actually, everything is interrelated in some way. And so I think, you said you saw a number of different doctors and you were bounced around trying to find answers to all of the different myriad of symptoms that you were experiencing, which were very wide ranging. And I'm curious on the piece of the GI piece, how did that evolve? Because I think sometimes when you have all these different things that are at play, it can be really hard for physicians to kind of dissect everything out and be like, okay, this is because of this, and this is because of IBS, and this, and kind of come up with a game plan of how to approach everything effectively.
Exactly. That is very well put. So I started off, it was really interesting how your body works. I started off, like I said, with post-infectious IBS. So I started off actually with like the diarrhea component. And then all of a sudden it turned and I stopped being able to go to the bathroom at all. Like I would go once every like 8 days. And that wasn't normal. So whereas it started off as like, diarrhea, it slowed down and became this motility issue where I just really couldn't go to the bathroom and I was looking pregnant and I mean, really like pregnant
Right.
and in pain all the time. And they said, oh, you must be anxious. You must be having anxiety. Now I'm a therapist and I know what's anxiety and what's not. And it was just so upsetting that someone's looking at me and they're like, have you tried cognitive behavioral therapy? And I'm like, I teach cognitive behavioral therapy. This is not, that's not what's going on here.
Yeah.
So it's just when you have people who are looking you dead in the face and saying that you have things that you don't have and you're trying to advocate for yourself and they're just not listening. It's just so upsetting. And I think that's probably one of the worst parts. When I finally got diagnosed with all these weird things that quite frankly, I hadn't even heard of half the stuff that I've been diagnosed with, it was a relief. It was like, okay, now I know what to do. I figured out what the problem is and we have a target and we can work on that. But it's the not knowing and having these doctors tell you that like there's nothing wrong with you, and it's crazy making. It's like you're doubting my experience. I'm telling you my experience. This is not normal. I know my body. I mean, I was a competitive swimmer I swam Division I and I swam all through college. I'm very in tune with my body and my body's not working. And I know it's not working, and you're telling me that it's in my head. That's just like so crazy making.
Yeah. Andrea, I'd love to get your perspective here because I think there are a number of patients with IBS-C that are somewhat complicated, like Katherine. They also have a number of other autonomic conditions, autoimmune conditions, and I think that can add a layer of complexity to your job as a gastroenterologist to kind of decipher everything and to help the patient feel heard and validated through the process. And I'm curious, from your perspective, how do you coordinate care with the other physicians that need to be a part of this complex medical management for patients like Katherine?
I think care coordination is a pretty difficult issue that a lot of providers face because kind of depending on the resources that you have available to you or what the infrastructure is like, and in a system that someone is practicing, they may or may not have very well developed, referral pipelines and kind of team-based approaches that can be used. It is pretty common that people with IBS can have a lot of other extraintestinal conditions or comorbidities as well. It doesn't necessarily mean that the IBS caused it or, in that sense, but there are probably some shared risk factors. There are probably things that contribute to the development of, GI dysfunction to some degree that are also shared in the development of other conditions outside of the digestive tract. So it's not uncommon for that to happen. I'm, fortunate that I am at a large academic institution, but not everyone has access to all sorts of different specialists. And even within specialists, I will tell you that kind of interest and expertise varies depending on the type of autoimmune disease at hand. I think the idea of multimodal care is becoming more prominent, and being able to offer that, in a more reliable fashion would be really, really critical for people to achieve better outcomes earlier and not suffer the way that, you did, Katherine, for so many years. I'm sure, it's very kind of fragmented care for a lot of people.
Yeah, that's a great point. That fragmented care, I think, also really inhibits recovery or management of the symptoms. And I think too, this fragmented system of healthcare delivery puts the burden onto the patient to find the next provider that's going to be knowledgeable enough and interested enough. When you're dealing with a number of pretty serious conditions that are impacting your day-to-day life, and then you add the complexity of having to seek out folks that are available to accept new patients, that understand where you're coming from, that are in your insurance network, and all these variables. It's it is a full-time job to find proper care and management. And Katherine, I'm just curious to get a little deeper on this. How did this impact your day-to-day functioning, your emotional well-being? You mentioned a little bit about the dismissiveness and the frustration that caused, but can you speak a little bit more about what that did to your overall quality of life?
Oh, it absolutely impacted it in a lot of very interesting ways. I've always been a very social and involved in lots of different activities and very active person. My entire life, I was very active. And I had to slow down. I had to change. My new normal was not anything that I didn't even recognize myself. I didn't have the energy to go out and do different events all weekend and go different places. I started to have little hobbies that were more sedentary. I took up gardening and things that are a little bit more home-based. My friend group shrunk. A lot of people didn't understand. I had to cancel plans last minute. I wasn't feeling well. They didn't get it. They thought I was a flake and they kind of dismissed me, and they didn't realize I was really being honest. I had every intention of going, but I got sick to my stomach and I couldn't make it. And, I felt really awful about having to cancel plans, and I had to keep canceling plans. I get to the point where now I say to people, I have every intention of going, but just know if anything happens, I'll let you know. But I mean, I can't really plan for this. Some days I'm good and some days I'm not. And I lost some people, but those really weren't good people to be in my life anyways. If they're going to not be my friends, not understand, what I'm going through, it weeds people out. Just I am so grateful for Daniel, my partner. We've been together now, coming up on a decade, and he has been my rock through all of this. And I'm just, thank God I have a person in my corner who's really been there, because I know a lot of people in my situation don't have that. And it's really hard doing this alone. It is just going to the doctors and taking in all of that information, having another set of ears to help you process everything, because it's a lot.
Yeah.
Finding the right doctors, doing, researching. He's originally from Germany, so he's very good at like researching, and he's like, I'm going to find the solutions, and like, so
That's great.
very grateful for that. But, it's hard.
Yeah.
A lot of people don't understand. They really don't. And I've had some mean things. People say things that are insensitive. And, it's about, like I said, sorting through all of that and say, I'm going to put that person over here, and I'm not going to allow their negativity to enter my force field, because that's not what I want. That's not the kind of relationship what I want. And surrounding yourself with people who build you up, not put you down.
Yes, well said. Andrea, from a clinical standpoint, how important is a patient's mindset and sense of self, even resiliency skills and coping mechanisms? How important are those in their overall day-to-day functioning in this, in IBS, in IBS-C specifically? And what can happen that's detrimental when patients don't have those skill sets or that mentality?
Yeah, oftentimes so much of living with IBS, a lot of patients express there is this sense of lack of control because of the relapsing and remitting nature of symptoms. Sometimes, you'll be hit with an exacerbation of your GI symptoms in a really unpredictable setting. And so that creates a lot of not just distress from the symptoms itself, but the distress of the unknown. And having some of these skills is incredibly useful to at least give people back some control over, living through a chronic condition. We talk about that bidirectional axis, of course. Gut symptoms can definitely worsen mood, stress, create anxiety. Living with chronic disease, chronic symptoms, I think, is incredibly, places an emotional and a psychological toll on people. And at the same time, stress and environmental trauma, insults, all of that can amplify symptoms as well. Yeah. So some of these coping mechanisms, strategies, building tools for resilience, although the situation may not be perfect, these are tools that can be applied to at least help, control what can be controlled to the best degree possible. And it's not, done in a silo, it's, done in partnership with other things that you will incorporate into your diet, lifestyle management, maybe medications, just really approaching that as part of your whole person health. So we've become more aware of how useful these are in kind of improving the trajectory of people over time.
Yeah, that's helpful. And Katherine, of course, in your professional role, you probably teach your patients all of these same strategies and these same things as they're navigating their own journeys too. So that's great. I'm curious about your treatment journey for IBS, for the constipation and the abdominal pain specifically. I know you mentioned the bloating and distension, which are so common and pretty commonly the most distressing symptoms for many patients. I think some patients have told me they're okay with not having a bowel movement on a regular basis, but it's that bloating and distension where they look and feel like they are,
Yep.
early stage of pregnancy and really distressed by that body piece of it, as well as the
Yeah.
feelings of embarrassment and all of the things that go along with that. So when we think about treatment, without going into specifics, how many things did you try before you finally got to where you're taking now that seems to be managing your symptoms better?
Well, first, the bloating for me, it's not just early stage pregnant. It looks like when it gets bad, it looks like I'm like 8 months pregnant,
Oh my
to the
goodness.
point where when I have to get ready, plan my outfits around how distended I am.
Wow.
And the pressure, not have anything that's tight around my abdomen because it hurts so much. It feels like I'm going to burst. So I'm pretty extreme. I think other people maybe aren't as extreme, but for me, I mean, it is debilitating. It's not just looking pregnant, which is embarrassing,
Right.
but I can't even wear a belt. Like it hurts. I struggle a lot also with visceral hypersensitivity. And I've had several surgeries in my abdomen. So I have pain. I have a lot of pain in my abdomen. I sit all day, every day I have this heating pad that I sit on my lap while I'm in session because I do telehealth now and it helps a little bit, but I mean, it's just, all day, every day. In terms of treatments, I have tried pretty much everything under the sun. I
Wow.
mean, I've tried everything: stool softeners, laxatives, the type that adds water into your bowel. I forgot what they're called. I've tried, prescription over the counter. I've tried kiwi. I've tried everything you can possibly, I mean, prunes, you name it. And
When you were kind of going through these different treatment methods, how did that discussion go? How did you frame that with your physician partner in like, hey doc, this isn't providing the level of relief that I need? Because I think that's a tricky conversation that many patients struggle with having. Like they don't know how to appropriately bring it up. They don't want to appear to be maybe dissatisfied because it is providing some level of relief usually, but not the level that they need. And so how
right.
did you approach that with your physician partner?
Yeah, I've tried this, I've tried this, I've tried this, I've tried this. None of these worked. Do you have any other recommendations? Because this had this side effect and didn't give me the results. This helped in this way, but didn't do enough. And even now when we're going to Vietnam, I have so many different medications I'm taking with me on the trip just in case. Everything from in case of diarrhea or constipation or nausea or, like I have an
Sure.
entire kit I
Yeah.
have to travel with me because I never know. I really never know.
Right.
So
Right.
it's a matter of, you know, really communicating clearly. I've been open to pretty much anything. I'll try jumping beans in my stomach. I'll try whatever you want to give me. I mean, like, let's try it. I just want to poop. Like,
Yeah. Yeah.
please just
It's about
help me
feeling
poop.
better for you.
Yeah.
Yeah. Yeah.
So, I've gotten to a point where I'm fed up, and I just want to feel better.
Andrea, how do you approach treatment changes with your patients? How do you have that conversation? And what tips would you have for patients on how to best have that conversation with their physician partner?
Yeah, I think this is very helpful to make sure that, patients and their physicians or their providers are understanding treatment responses from the same perspective in order for, the physician or the provider to make an informed change. So, for example, if you are taking a treatment and it's not helpful, I think we want to know in which ways. So, is it helpful in making the stool form better, but it's just not helpful for the bloating and the pain? Or is it helpful for the pain, but you still feel like you're, constipated and still feeling that you're not emptying adequately? Because we have a great understanding of medications in terms of their effect when we look at that as an individual therapy, but sometimes we need to combine therapies. And sometimes we need to think about how we can augment one aspect of therapy to target a symptom that's not being adequately addressed with the current approach. And if we don't know that, we might put someone at risk of just starting and stopping and starting and stopping and just putting people down this kind of trial and error, and not getting the most impact that we can out of each treatment. And sometimes different treatments have different things that they can offer. So understanding that part of it, really getting some details about that, I think, we should be doing a better job of, grabbing that information from people when they come into the office and they explain, hey, this isn't working. Well, we want to know in which ways, or if it's not at all effective, then that's also important too. Not in any area of their gut health. These are things that we need to understand.
Yeah, that's a great point. Catherine, your story is so interesting. It has so many nuances, and I appreciate the fact that you are so transparent and vulnerable in your illness journey narrative, and I think that's going to be so helpful for so many people because that's not common, as you know. A lot of patients feel very uncomfortable talking about these symptoms and their experience with the healthcare navigation piece of it. And but I think, I'm thinking about something you said, like you got to the point where you don't care, you just want to feel better. And I think for many of us, we have to get to that point where then we're completely honest with our physician partners, and we're not holding anything back. We're telling you everything that we're experiencing, the good, the bad, the ugly. And that's what finally is the impetus to get us to change the treatment, or to change our mindset, or to change our diet, or whatever, or a combination of all of those things, to finally get the relief that we're looking for. And I think what I have heard from you today is honesty is best when communicating with your physician partner. Like, they really want to be your partner, and there are so many different pieces of a complex patient puzzle that need to fit perfectly in order for you to be understood. So without that honesty piece, it's going to be really hard to get symptom relief, no matter what your diagnosis is.
Yeah, they can't help you if they don't know.
Right.
Right?
Right. They're not mind readers. Andrea cannot read your mind, so you must tell her how you're feeling.
Yeah. And we all poop. I mean, it's part of our bodies, and no one really likes to go around talking about it, but we all do it. And, being able to advocate for yourself is really essential, because you are your best advocate, honestly. And they can't help you if they don't know. So being able to be like, okay, look, this is what's happening. Track your symptoms, have like really good information, write down your questions before you get to your doctor's appointment. I don't know about listeners out there, but I know that sometimes I get really nervous because I've got so many things and I don't want to forget anything. So I write it all down, and that way I have kind of goals in mind, make sure that I address all the questions that I have. I bring like my binder with all of my paperwork and everything. So I don't, I don't have it. You go in there prepared. And so that, you're able to ask the right questions, get the right answers, and don't be afraid to message them on the portal and follow up. If you forgot to ask something, ask it. Don't be afraid to advocate for yourself, because, at the end of the day, it's your body, right? And we only have one of them. So, take care of it and really do everything that you can to try to understand what's happening to it, so that you can also be the best version of yourself. It's not all just about taking this pill and you get better. You have to have really good control over your mind and control over, what you have control over, because there's so much that's out of control, right? And the one thing that you can control is how you think and how that's going to affect how you feel, because there is absolutely a mind-body connection. And the one thing that I will say that has gotten me through all of this is my mind and my attitude. I've never given up. And I think that is a testament from my swimming background and, getting up 4 in the morning to train and all that from a young age. But like, I am determined to figure out, I didn't get answers from you. I'm going to find somebody. If you don't live in an area where there's good research institutions and you are able to travel, go someplace where there's research, because they figure stuff out fast. And they don't bounce you around to different people who don't know what they're doing.
Yeah.
Right. So it's a matter of really have some grit here and don't give up until you get answers, because, knowledge is power, and there are a lot of things that can be done to help you feel better holistically, prescription wise, otherwise. I mean, there's a lot that can be done. So until you find what works for you, don't stop.
I agree. Here. Andrea, what are your tips for patients can you top Katherine? Don't give up, don't stop.
I think that it's, Katherine's experience. I feel like a lot of people go through that journey, and oftentimes people are afraid to speak up and ask questions. And particularly with IBS, having clear communication between a patient and their provider, I think that's important in any condition, any health condition, but especially when this is it's really about the symptoms, and understanding the symptoms can help us develop a plan. We have to be able to really connect on that element. And I think that's one of the biggest challenges a lot of patients with IBS run into. The traditional medical system doesn't always leave a lot of space for great communication between patients and physicians. And that is hard. That's a stressful area for patients, but also physicians. That's why people feel dismissed, not heard, oftentimes going years before they understand what's going on. It takes time to communicate. And so that I think, what you bring up, Katherine, is, advocating for yourself and realizing, there are pathways that I can continue to pursue to really, still improve, my symptom. I'm not just destined to suffer like this forever. And I remind people that it's a chronic condition, but it's treatable. People do get better. Don't just feel hopeless.
Yeah. Great takeaways. Gosh, Katherine, thank you so much. You've given us such a great insight into this diagnostic and treatment journey with you, and some great takeaways. So thank you so much for joining us. And Andrea, thank you as always. Great insights from the clinical perspective for our patients who are listening today. Excited to share with you a new season of the podcast. Lots of great guests are coming up in the months to come. So hope you'll continue to tune in. And until next time, we'll see you real soon. Bye, everyone.
Bye.